Darlene McCrae was eager to book an appointment for her next COVID shot.
This is important. We have a vaccine against that variant. I want it as soon as possible.
Fall vaccination campaigns are getting underway across the country. Quebec and Alberta have just begun their rollout of the latest Health Canada-approved COVID vaccine targeting a newer variant in long-term care and seniors' homes.
We can give flu, COVID, and pneumovax, pneumonia shots too.
It comes amid a rise in COVID cases and concerns around waning immunity.
In Quebec, it's quite problematic. We're estimating about 20 to 30,000 new cases daily. I actually was just on service last week, and we actually had 4 severe COVID cases.
The new vaccine is particularly important for people who are vulnerable, says infectious disease specialist Dr. Don Vin.
So people shouldn't rely on the fact that, well, I've got the older vaccines, I got the original one, or I got the bivalent one, and I don't really need a booster, because it's not boosting what you've been previously immunized against. It's essentially a new vaccine.
In Quebec, COVID cases and hospitalizations have been climbing since August, and other parts of the country have seen increases too, adding urgency to the rollout.
I am really advocating that people get their vaccine doses as soon as they can, and that provinces start making them available as soon as they can, particularly to the highest risk.
We took our foot off the gas. We should have been a little more proactive in getting these vaccines out sooner.
In Alberta, this home for people with dementia has been dealing with an outbreak.
When we get into outbreak, we have to go right back into the masking and the goggles, doing all the PPEs.
Some hospitals and health authorities are adjusting too, bringing back masking mandates they dropped just a few months ago. Alison Northcott, CBC News, Montreal.
With us now, Dr. Isaac Bogosh, an infectious diseases specialist at Toronto General Hospital. So, Dr. Bogosh, this isn't just about COVID, right? There's a slew of other viruses out there, flu, RSV. What do people need to know when they're planning these shots?
Yeah, it's important to recognize that the vaccines for these maladies are going to be rolling out in the next couple of weeks. And people should be mindful that, the season is here and they should really be getting these vaccines, especially people at greatest risk for severe illness. It's okay to get your flu shot and your COVID shot at the same time. It might not be comfortable, but if it's more convenient for people, they certainly can do that. And new this year is the RSV vaccine. It's a license for people over the age of 60. Different provinces might have different protocols in terms of how they roll it out, but that's a nasty infection. And the vaccine appears to be able to reduce severe infection. So that's another exciting development as well.
People have a lot of questions, though, right? So what about people who had COVID in the last few months, or maybe they thought it was the flu or a cold, but they're really not sure? Should they be waiting to get the shot?
Yeah, in general, 6 months after the most recent infection or most recent vaccination is reasonable. But people who are at risk for more severe manifestations of COVID, that's not a hard and fast rule, and that can be shortened a little bit as well. But of course, if anyone has any questions, it's best to speak with a healthcare provider to get individual guidance.
All right, Dr. Bogosh, thank you as always.
My pleasure.